Hi guys, welcome back to my channel. Today's video is going to be totally and completely different to anything that I have ever filmed before. Today I'm going to be talking about working as a pharmacy technician. I'm very aware that this is only going to be applicable to a very small amount of people, and that's totally fine. So if that is something you're interested in, learning more about the career of a pharmacy technician in community pharmacy in Ireland, then just keep watching. Okay guys, so I have notes written down in my lovely book that my friend Mary got me. Boss babe. So the reason I wanted to record this video was because I went back to college as a mature student. I think I was maybe 27, 28, to become a pharmacy technician. And at the time, I looked up YouTube videos, I looked up articles just to kind of give myself a feel for, you know, what exactly does a technician do? What's their day-to-day in community pharmacy? And I couldn't find anything. What I did find was kind of more geared around the American system. So that wasn't helpful to me. So I kind of just wanted to always film like an information video for people who are considering changing their careers. People are making decisions for CAO, students are doing that kind of thing, so it's a good time of year as well to put a video out like this, I guess. I'm not a career counsellor in any sense of the word. Everything that I'm going to tell you here is my own personal opinion. It's nothing to do with anybody else. I was working for a couple of different groups, both in the Midlands and in Dublin. I'm no longer working as a pharmacy technician in general. I just want to put that out there as well. I'm working in training at the moment in healthcare, so I just want to put that out there just as a disclaimer at the very beginning. Again, a little bit of clarity. You can work as a pharmacy technician in a hospital as well. I don't have hospital experience, so that's not something that I'm going to talk about. What I'm going to talk about is exclusively community experience. The role of a pharmacy technician in community has just blown up, and there's a lot of different responsibilities that the technician is taking on that frees up the pharmacist now. So they're very much a support to the pharmacist. Usually your technician will be the person that might meet you at the counter, will take your prescription in for you, will ask you, you know, what you need. If you're given in a prescription for an antibiotic, they'll ask you, are you allergic to penicillin? They'll ask you if you're on any other medication, if you're a new patient, lots of different things like that. They'll go in the back then, they'll take that prescription, they'll look you up in the computer, or they'll create a new profile for you on the computer, a new record. They will create a label for your medication. They'll then go to the shelf and they will take that medication from the shelf. They will at all times check that medication off the prescription. They'll check they've given you the right dose, the right quantity, the right strength, the right medication, and they'll also check back and see if there are any interactions between what you might currently be on medication-wise and what this particular prescription is for. So that's kind of your first check within a pharmacy. Again, from my experience, sometimes it works a little bit different in different pharmacies, but from my experience, that's how I would have worked in the pharmacies that I've worked in. The next thing then is the pharmacist will check it. So the pharmacist will go again, they'll get your prescription, they'll check off your name, your address, that if you have a medical card number, that's right. They'll check that the label is correct. They'll check, they'll do all of these different kinds of checks, and again do a check on, you know, whether or not your medication is suitable for you, and if there's any queries on your medication, either the technician or the pharmacist will ring back your doctor's surgery. So that's kind of like a day, not a day, it's a part of a day of a pharmacy technician's role. You're also going to take in your orders, you're going to put your orders away, you might place your orders. You might be a technician that's in charge of buying for your pharmacy, so you might have a totally different role. You're going to be out front of shop, you're going to be advising people on over-the-counter medications. So, you know, the person that you go in and buy maybe Solpadeine from, and they have to ask you all those questions that, you know, you don't want to answer and they don't want to ask, but you have to do. In a lot of cases, it will be your technician. So that's kind of a really short synopsis of what a technician does. In different pharmacies, you might have nursing homes. A technician will very firmly be in charge of a nursing home. You might have a lot of blister pack patients, like elderly patients that need compliance aids, which are blister packs that you put your medication into. You could have patients with different needs in terms of addiction services, and you'd also be in charge of anything to do with health promotion within the pharmacy, maybe taking somebody's blood pressure if they needed to, checking somebody's blood glucose levels, and really you're very much a support for the pharmacist. So I don't want to kind of go on too much about that because every pharmacy is different, but from my experience, that's what a pharmacy technician does. There's a lot going on. So what kind of person should you be in order to be a good pharmacy technician? Well, number one, I would say that if you don't like coffee already, start drinking it. And if you don't like cold coffee already, start drinking it. So I would say that you need to be somebody who is 100% committed to customer service, to patient care. You're somebody that needs to have empathy. You're somebody that needs to like people. If you do not like people, and that's fine, some people don't like the public, that's fine. If you do not like people, you do not like the public, I would strongly reconsider being a pharmacy technician. Your role is 100% customer facing all of the time. So you need to have that level of energy going into work every single day and every minute of every day. You know, within 10 minutes, you could be dealing with somebody who has lost a family member, somebody who needs their addiction medication, somebody who is shoplifting, somebody who wants something for a really sick baby. Like, there's so much that you could be dealing with within 10 minutes. You have to be robust in that sense, and you have to be the type of person that can prioritize, but can have empathy for all of those people within that 10-minute time frame. So you really do need to be somebody who is caring and really wants to do the very best for your patients and for your customers, and just has that level of empathy that nobody is going to get anywhere else. And you really have to be A1 with customer service and just being nice to people. Working as a pharmacy technician prepares you for everything in life. Everything. You know, you can walk into any sort of job and just deal with it because you've always dealt with worse in pharmacy. It's, you know, it's an amazing area and you get to help so many people, but you are challenged every single day in your role. So just remember that as well. It is challenging, but it sets you up so well for everything else that you're going to do in life. I did my course in Athlone IT. That was a full-time 2-year higher certificate in science for specific to pharmacy technicians. I know they also do that course in Carlow, they do it in Letterkenny, they do it in DIT, and I think there might be another new course in, I'll have to look that up. I'll leave that in the description box down below. I should have looked that up, sorry. The other option that you have is going through the IPU, which is the Irish Pharmacy Union. If you already work in pharmacy as an over-the-counter salesperson or a sales advisor, and you feel like, oh, I really want to get into the dispensary and look at the more clinical side of pharmacy, that might be an option for you if you want to progress with the company that you're working with at the time or whatnot. But there is a different option for the IPU. So that is a distance learning course that you can do through the Irish Pharmacy Union. But again, that's something that you can look up if it's a case that you're already working in pharmacy and you don't want to quit your job to do 2 years full time to come back. You can do that through the IPU. It is totally different. From what I know, you might attend a course day once every couple of months, but you do not get a higher certificate in science. That is the difference. So let me see, I'm just going to pick out a random day that I would have worked as a technician. So you go in, you might be in charge of the tills, so you will maybe open up the shop, count your tills, get your tills all ready. Then you look and see, are there any prescriptions that, you know, people are calling in for today? Do you have to do up any prescriptions? If your order comes in, you put your order away. People that walk in, you're going to have to do their prescriptions. If somebody rings in to say, I need my blister pack for tomorrow, you're going to work on that. In the meantime, then, a huge part of pharmacy is the claims process. So for all the medical card patients, the pharmacy gets paid by the government for those prescriptions, for the dispensing of those prescriptions and for the products. You might be responsible for looking back through all the prescriptions. You could have 1,000 prescriptions in a month and making sure they're absolutely perfect and sending that claim off to the HSE. There's an area in the HSE that deal with that, and then making sure that you got paid for absolutely everything that you've dispensed and everything was right, and that you've dispensed everything correctly, and that you got paid for every prescription that you put through. So that's a really huge job. So that would be a massive part of your day as well. You might have patients coming in for their flu vaccinations. You might have to get that prepared in order for the pharmacist to be able to do that. And then you're going to be helping out at the front of shop in the sense that if anybody comes in looking for over-the-counter medications, you'll be helping with that. And a lot of pharmacies as well, where there might be lunches, you might be covering a cosmetics counter or something like that. So you do have to expect to work in different areas of the shop as well. I would say that. Strangely enough, I hated working in the beauty section of the pharmacy when I was a technician, because to be honest, I actually had so much to do as a technician that I was like, I don't have time to be over here on beauty. But at times you need to cover lunches, and you need to do what's best for the business. So I just would say be mindful of that if you go in and you're working somewhere and they're like, oh, you need to cover the beauty counter for an hour, that just has to be done. That's just the way it is. I'm going to be completely honest about this. Pay as a pharmacy technician is low. It is low. It can vary from minimum wage up to maybe €16 an hour. If you are getting paid €16 an hour, you are extremely experienced, you are well looked after by your employer, and you're probably doing something else like helping out with buying, or you probably have another part in the business that's bigger than the standard technician role within a community pharmacy, if that makes sense. So you might be dispensing and doing your regular duties, but you're also looking after buying, or you're also looking after maybe quite a large nursing home, or you have just different responsibilities within the business. Your success in your role as a technician, has an awful lot to do with who teaches you. So I don't mean in college. I mean, like, the courses in any of the ITs, I'm sure, are all fantastic, but I would strongly say that 80% of what you learn is on the job. If you have a brilliant pharmacist, which I was so lucky, I've worked with, I would say, the absolute best pharmacists, the absolute best technicians and managers. Like, I really, I've been so incredibly lucky. I've learned so much from all of them, and they've all been brilliant at their jobs, really, really brilliant. So you will learn so much from those people, and I really do think that those people are, in essence, what is going to make you or break you in your career. So in a roundabout way, I'm trying to say to you, when you go to maybe look for a placement or go to a pharmacy to work in, pick your people wisely. So if you are on placement and you're getting a bad vibe and the pharmacist is being just shitty to you, or somebody's just not being nice, call it. Like, flag that straight away. Ask to be moved. If it's a situation where you're going through your college, ask to be moved. Just don't waste time in a situation where you're not going to learn. You really, really need to learn. So my very first placement was with a fantastic pharmacist. He was just so kind and so nice, and I had two amazing technicians who are actually, they're all still my friends, which is like the most amazing thing. They're all fantastic. So two senior technicians and an amazing pharmacist, and I learned so much from them. They taught me so much. My next job then, another pharmacist who again is one of my friends now. I learned so much from them. I do think that if my situation had been different, and I've heard people being put in places where people aren't nice, you're not going to thrive in that environment. So really do look after yourself in that sense, and always try and learn and be in a good learning environment, because you're only as good as the person who teaches you. And just remember that with everything in pharmacy, you are going to be taught your basic dispensing in college, and that's fine. Things are very, very different when there's a patient in front of you waiting for their prescription. They might be upset, they might be in a rush, they might be annoyed. And when you have somebody that you can lean on in terms of, how do I deal with this? What do I do? And that they can guide you in that way, that's worth everything in your career as a technician. Maintain the highest level of patient care, make sure your customer service is A1, and your attention to detail in pharmacy is crucial, absolutely crucial. Really being interested in people, interested in medication, having an interest in science and the nitty-gritty of how drugs interact with each other, that's going to really be the makings and breakings of you. I would definitely say you have lots of career prospects as a technician, but you need to work hard, and that goes for everything in life, but you really do need to work hard. Again, it's about being with a good pharmacy group. It's about having a good manager and somebody who is going to give you more responsibility within your role. I would say that career prospects for people who are experienced pharmacy technicians, I don't mean somebody that's going to come in straight after college. Like, no, that's not going to happen. You're going to need 3, 4, maybe 5 years experience in a dispensary doing your everyday stuff. But career prospects include becoming a buyer for a pharmacy, or maybe a buyer for a pharmacy group if that's something that interests you. Becoming a pharmacist. Like, some technicians actually decide, you know what, I want to be the pharmacist, and it's a great grounding for becoming a pharmacist. Maybe you decide, I'm not too fussed on the clinical side of things, I'd like to just get out onto the shop floor and become a store manager and manage people, and that's another option that you would have as a pharmacy technician. I know a couple of my friends are actually claims specialists. So what I spoke about a couple of minutes ago about looking after the claims and getting the money back from the HSE for the medical card prescriptions that you dispense, some of my friends actually work solely on doing that for bigger groups. So that's another option that is available to you as a pharmacy technician. So I do think it's a brilliant career for giving you great confidence in dealing with lots of situations, but also for career progression. So I really hope that that was in some way helpful to people. I know that had I had a video like this when I was going forward to change my career, it would have really, really helped me. So I really hope that I've helped at least one person. Please, if you have any questions, leave them down below in the comments section. Thanks so much for watching, guys, and best of luck with your future endeavors. I'll see you next time. Bye.